Ava. And then Dr. Imran will not be able to participate. It shows that he's on, but apparently he cannot speak. So it'll be short, unless, and Ahava, tell me what you think of this, when we are both done. Excuse me. If people have other questions on other issues that maybe we could look up while, on the fly if we can. If not, they can message us later.
Okay.
If people are interested in doing something like that, I would certainly be game.
Okay, wonderful.
Okay, so here I go. Fevers. My experience with fevers is pretty limited because we found something that works and it works great every time. And so I haven't had to look past that, and that would be Belladonna 30C. We use it a lot with my very young grandchildren. So Belladonna 30C, the potency is anywhere from every 30 minutes to every 1 to 2 hours. When I've got something really serious going on with my grandsons where they've got a bug, right? And it's really bad and they look like they're literally just withering away and they've got a fever, I go even more aggressively. I may go every 3, 4, 5 minutes with muscle testing, of course. So that is the first one, Belladonna 30C. The other one is also Belladonna, and that is 3C. And a lot of people really like that, and that's one that Joette Calabrese recommends. And I would say the same thing with that. You will find that one, for example, in the sinus protocol where you use Sanguinaria 200C along with or at the same time with Belladonna 3C, and that you would add the Belladonna if with the sinus infection you are also having a headache. Rachel, would you turn off your mic, please? Rachel.
Yes, I am.
Thank you. Okay. The next one is also I got from Joette Calabrese. That is sulfur 30C. And she said every 30 minutes. Again, I muscle test, and if it's a much more serious thing, I will do more often. And of course, you go further and further apart as improvement ensues. One that I got from Ikram Mansour is a trio combo. So they all go together. They are all 30C, and they are Arsenica malbum 30, Belladonna 30, and Nux vomica 30. Those are all taken together. He didn't specify on frequency, but again, because I do muscle testing, I just, they muscle test for it, I would go for it. Aconite 30C. This one I also got from Joette Calabrese. And it is for rapid onset, like it comes on suddenly, rapid onset of a high fever. You must use it within the first 12 hours for it to be very effective. If you go past the 12-hour mark, it's not going to be of much use to you. So at that point, you look to some of these other remedies. For those who have a flu with pain that also comes with a fever, I got this one from Joette Calabrese as well. And it is Eupatorium 30C. And again, I would do this according to muscle testing, maybe every 30 minutes, maybe every 1 or 2 hours, maybe more frequently than 30 minutes. That's Eupatorium 30C, Eupatorium, Eupatorium 30C. For fever that accompanies teething, so this is going to be for toddlers, Chamomilla 200C. This is by Joette Calabrese also. And again, I would say as frequently as needed according to muscle testing, even as frequently as every 5 or 10 minutes, maybe 30 minutes, maybe every hour or two, depending on how the child is reacting. Now, in the book entitled Soham Series of Natural Healing, excuse me, Soham Series of Natural Healing, Volume 3, there is a list of remedies called balance remedies, and the initials for that are BR. So there is a remedy, it is BR number 10, and it is called Fever and Infection Balance 50, 50M. This is the base 10 rate for it. 2, 3, 7, 8, 8, and then the number 10. So you would put the dial on the 10, not on a 1 and a 0, but the number 10 itself. It is for all fevers. So for a high fever infection, you might be dosing at 6 times a day. And then, of course, you reduce as improvement ensues. For the low fever, or some people have chronic kind of long-term low grade fevers. The recommendation for this same remedy is 1 time a day over an extended period of time. Some would say until the symptoms are gone. I always say until you muscle test negative. The next 3 are from the Yvonne Combe, C-O-M-B-E, Yvonne Combe rate sheet. They are all in base 10. The one called general flu fever, the rate for that is 6, 6, 7, 7. That's general flu fever, 6, 6, 7, 7. The next one, Yvonne Combe base 10, is for a relapsing fever. So it comes, you treat it, it comes back, you treat it again, or even without treatment, they come and go. So this is the rate for that for a relapsing fever is 1, 1, 2, 3, 4. And then the last one I have is also Yvonne Combe, base 10, and that is for general fever. Whereas the first of the 3 was general flu fever, this one is just called general fever. The rate for this one is 1, 1, 8, 9, and 10, not 1, 0, 10. For any of the rates that come from the rate sheets, they don't provide a recommended potency. They don't provide a recommended frequency. So you kind of have to play with that one. Muscle test, I cannot recommend muscle testing enough. It's just the most amazing tool ever. And so you just go by that, and of course, go till your symptoms are gone, or as I do, until you no longer muscle test positive for that remedy. And that is everything that I have. So I hand you over to Ahava McLaughlin. And Ahava, here you go.
Thank you, B, so much for that. I am going to see if I can share the screen. Dr. Imran, if you hear me, I don't know if you're able to share, enable my ability to screen share, or B, are you the host? Who's the host?
I am not, so I have no idea how to control that.
Okay.
Maybe you'll just have to describe.
Okay, I just happened to be prepared today with a with a
Oh,
PowerPoint. Yeah, it's okay. Let me see if Just give me 1 second. Let me see if he's able to.
In the meantime, Gilla Weiss, I hope I'm pronouncing your name properly. Would you turn off your mic, please? Gilla Weiss.
Okay, thank you. He's gonna see if he can. I think his like internet is shaky. Um, okay. All right. Okay, so I'll get started just by introducing myself. 1 second. Okay. Um, so my name is Ahava McLaughlin. I'm a traditional naturopath from South Florida, and I do a lot of sick care. I'm actually the host now. Okay, amazing. So I will be able to share the screen, I think, now with that ability. Let me see here. Okay. All right. I think everybody should be able to see this. Yes? Okay, amazing.
Yes.
So I do a lot of sick care actually on a daily basis, just about, unfortunately, but fortunately for you guys. And so this is something that's a integral part of my practice besides doing like in-depth consults. And I have a little bit of a PowerPoint slide here. I'm gonna like just skip through some of this. I don't want to make it so long, but I love this screen because how does a fever really even get a hold in general of if your body is in a good place? Why would you even get a fever to begin with? Why would your immune system pick up on a virus and get sick? Um, so my theory is the amount of sugar that we really are having in our diets. Of course, there's other factors like stress and chemicals and different kinds of things that are filling up our cells to toxic overload. But I really like to stress the sugar because I do notice that a lot of clients have a lot of sugar in their diet and their kids' diet more than they think it is because it's in little bits and pieces, and that really adds up with all the processed snacks that get sent out to schools for the kids. So here's a fun, sort of visual, I guess you could say, about sugar. Sugar in babies' body is called eczema. Sugar in a child's brain is called ADHD. Sugar in the adults is called brain fog. In the elderly, it's dementia. In your eyes, it's glaucoma. In your teeth, it's called cavities. In your skin, it's called inflammation and aging. In your sleep, it's called insomnia. In your blood, it's called diabetes. In your ovaries, it's called yeast and candida. And in your cells, it gets called fever, and excess sugar in your system overall is called cancer. So again, this is not just the one thing, but I do feel like this is a huge contributing factor to why people get sick so often, multiple times a year. And I think this is really important to really, really understand because it's, yeah, no, don't eat sugar, but really, really think about how much sugar you are getting in your diet as well as your clients' or patients' diets. Looking at that is going to be critical. Okay. Now, when we do get a fever, when we do get a fever, that's a good sign that your immune system is functioning. So if someone calls me and says, I really feel fatigued, my body hurts, I have a sore throat, I have a cough, something like that, and I'm like, where's the fever? They're like, I don't ever get fevers, I just get sick. To me, that's like, okay, there's something going on with the immune system, and most likely these people do unfortunately have underlying pathogenic issues, and their body is not responding the way it needs to. So if you do get a fever, I'm sorry, if you do fall sick, getting a fever is going to be critical, because that lets us know that your immune system is working really hard to heat up the body to kill off that toxin that has entered. Otherwise it's not, functioning to the best. So a fever, we're all scared of fevers. Fevers can be good. And the first thing most people want to do is give the Tylenol and the Motrin, which depletes glutathione, which masks the body's ability to be able to kill off the pathogen, and then therefore prolonging the sick process for that person because the body's not able to do its thing. So what's beautiful about homeopathy, as well as naturopathic remedies and frequencies and whatnot, is that it's literally supporting the body through the process versus like masking and covering up that fever the
Sorry,
body
Emma,
needs.
your boat scared me more than the mechanic
I
did.
think Giselle, maybe that's Svia. Could you put on mute, please? Thank you so much. Okay, so I always say that it's amazing to have a baseline. Actually, pay attention to your tongue, because when you get a fever, usually it brings up all the candida that's from your stomach as well, because it's probably killing off some of that yeast and whatnot. If you some of you I think are joined. Oh, that's probably what it is. Okay. So looking at the tongue is going to be really, really good thing to do. You to have a baseline just in general before you're ever sick, to know, what does your tongue normally look like? The center of the tongue is usually the spleen. The tip of the tongue is the heart, the liver and gallbladder on the sides of the tongue when it looks wavy. So understanding, how much of a film of yeast you have on there can let you know your digestive status. Um, and so don't be alarmed when you get a fever and you all of a sudden have so much more yeast on the tongue. What it's happening is that the fever is killing off the virus or bacteria. Okay, and then that causes a candida to come up. Oops. Okay. Okay, I talked over this a little bit. Okay, I'm gonna move on. Okay, so some remedies here. Fever, horsetail tea is amazing for fever. It helps the kidneys to eliminate. We also have to remember that that's why the kids, if you notice your kids, like, where did they get these purple eyes from? It's the kidneys really overworking to eliminate also the toxins through the urine. And so the horsetail tea can really be helpful for the kidneys. And let's see. Like heavy, oops, I'm sorry that my light went off. 1 second. How do I do that? Start video. Okay. Um, yeah, so the kidneys show up underneath the eyes. That's how we know how badly the kidneys are in Chinese medicine. That's how we know that the kidneys are struggling. So if the kidneys are struggling, we obviously don't want to give too much extra protein, because it causes more urea, which is more waste products, more for your body to process, and it's not helpful when you are in bone broth soup is fine and all that, but like heavy on the proteins is, and it's probably not even something that somebody wants anyways, because they don't want to eat heavy, they don't feel good. Okay. So, this is something good to know about fever. Putting on a hat or warming the feet, wrapping the child warmly. A lot of warmth is lost during a fever. So a lot of times I know that the original thought process is to unwrap your child. Don't keep, obviously you don't want to keep them too hot, but you want to keep them fairly covered. Obviously you go with your child or yourself and how you're feeling, but the idea is that a lot of warmth is lost during a fever. So the more you unwrap and basically let your child be naked, you know what I'm saying? Like without clothes, the more the body has to compensate to keep the body warm and fight off that fever, which could actually do the opposite of what you want and make the fever go higher. So it raises the result will be fever rising to make up for lost heat. So if you use cool rags and undress them, yeah, it'll try and rise to make up for lost heat. The body knows what it's doing. So trust it to do its job. Skin to skin is great. And I love Epsom salt baths, especially like warm ones. It doesn't need to be overly hot, but that keeps the body temperature regulated. And it actually tends, if you notice, that when you've given your child an Epsom salt bath in warm water, their fever actually goes down, right? So a couple of notches. Okay. Another remedy I like is belladonna. B mentioned this. It aids in fever fighting illness. It helps it do its job. And let's see. Talking about neurologically normal children, the brain has an internal regulatory mechanism. It does not allow the fever to rise out of control. Fevers that are produced by viral or bacterial infections will not cause brain damage in most cases. Sometimes these things can cross the blood-brain barrier, but most of the time, really, this isn't the case and isn't something you should be fairly concerned about. Obviously, helping the body do its job, you're really gonna probably avoid any kind of severe symptom like that. Okay. I talked about Epsom salt baths. I like two to 4 cups of Epsom salt with your own essential oil of lavender. I don't like the Epsom salts that come with the lavender. It's low grade lavender. So use your own that's high quality. Costco sells them in big 5-pound bags, 2 of them. Also, the spine using peppermint essential oil down the spine can actually lower the fever by a couple of notches if it gets too uncomfortable. If you have a baby, please do not use peppermint. You can use something like lavender, frankincense, tea tree oil, lemon essential oil, but not peppermint. It's too strong for their skin. Okay. Okay, so the power of 3 or 4, so follow the symptoms, common sense, gut intuition. I know, trust me, I'm a mom. When my kids get sick, it's like all my naturopathic senses and training goes out the window. My emotions kick in, and you have to just regroup and calm down and go, okay, what's going on here? How can I help? Where are the symptoms? Where is it coming from? Do I think it's viral? Do I think it's bacterial? Is it an ear infection? Is it this child that particularly gets sinuses issues? Is it the child that usually gets ear infections? Is it the child that gets like the coughs that don't stop? Like you have to know which child you're dealing with because we're all different and they all, if you notice, they will have patterns in each child is different and how the symptoms present, where it tends to kind of go to. I love using herbals, homeopathy, nutraceuticals, and frequencies. Scalar wave technology, I use a bioresonance scanner, and that can be really, really helpful in aiding the body heal and from many, many, many issues. I'm actually having a webinar tomorrow at 5 p.m. Eastern on this technology. If anybody wants, please send me a message. Okay. Let's see. Okay. Aconite is always for the onset of a symptom or fever. So if the fever, like we said, just came out of nowhere, that's when you will use aconite, to see if you can kind of mitigate the onset of that symptom. I also typically gravitate towards oxalisolicinum. I really hope I'm saying that right. I don't know. That's how I think it's pronounced. It's a mouthful. It's for the onset of flu-like symptoms, and I find it to work really, really well. And what's great about this is that Walgreens and CVS carry this, and it's usually 24-hour pharmacy. So sometimes in the middle of the night, something happens and you don't have that homeopathic, you can go to CVS or Walgreens and get the oxalisolicinum. It works great. The faster you catch it, like don't wait. The faster you catch it, the more it's going to be able to be helpful and help. Gelsenium is also great for flu-like symptoms. This is my basic, screenshot this. This is my basic for, I guess you could say, to any sickness that comes on. I am a big proponent of high dose vitamin D, high dose vitamin A, high dose vitamin C, when there is an acute situation. I don't use this high dose protocol in general long term. This is acute. I use this also for, the COVID era. And I really find this to be very, very helpful and lessen the time that the body is under stress. I want to make mention that quercetin is a bioflavonoid, and I happen to really love it. I am never without quercetin in my house. Not only is it amazing for allergies and histamine issues, it also blocks the cell from letting a virus or bacteria from entering into the cell. I can't stress enough that every home should have quercetin in it, as well as vitamin C, making sure the vitamin C is like an organic, non-GMO source. I love Revitalize Wellness for that because I know that it's a high quality vitamin C. And people who would not be able to use vitamin C ascorbic acid specifically is the G6PD genetic mutation people that they might have a hard time doing a vitamin C protocol. Now, vitamin D in high doses, again, 3 days, vitamin A in high doses for 3 days is going to be helpful. And I have it broken down here for adults, children, and babies. Okay. And vitamin D, vitamin A are fat soluble vitamins. So you always want to take it with a fat and versus like on, on an empty stomach. Okay. All right. So once you know what the fever is, right? We, is it an ear infection? Is there a cough involved? Um, then we can, sort of like get really honing in on different symptoms that happen for everybody. I think first I'll start just with like this flu bomb. Um, this is uh this is really amazing. It works really, really well. Again, oxalisolicinum is an amazing go-to for me. Garlic, 1 clove, crushed, ginger, also finely chopped, juice of lemon, honey, eucalyptus or tea tree oil, cayenne pepper. Cayenne pepper makes the throat, for example, when you drink it, it causes the blood circulation to come to the area to bring in those white blood cells and everything that it needs to kill off the infection. So I love this duo, or not duo, but this concoction of remedies. And okay, so I'll go back to coughs. Onion poultice on the feet. I also like to chop up onion and make a syrup in honey. And it literally you just like slice onions and then put honey in a little mason jar, and it turns into a syrup. You can sprinkle cayenne pepper in it if you can tolerate it. And you basically just drink 1 teaspoon at a time. And this is not only helpful for coughs, but also sore throats. And very, very stubborn coughs that come with a fever, I really, really, really like to use a nebulizer. And I use colloidal silver with that. And you can't, this is not something you can do once or twice a day. You really need to do it like 3, 6 times a day to see a difference. So, I have people tell me, oh, I used it, it's not working. No, no, no. You need to be using it. Like I use it personally like 5, 6 times in a day, 15 minutes at a time, for stubborn coughs. And usually within 24 hours, I see huge improvement and movement. And of course, you keep going as needed. But I really like this for coughs, um, because I know that it's going to work for the most part. Ear infection. How do you know your child had a fever or you had a fever and you seem to have been getting better, and then all of a sudden there's a fever again, right? And you're like, what is going on? Well, the first thing I would check is the ears. So I like to use food grade hydrogen peroxide. So you take a syringe and you drop the into the ear canal. So you have the person just lay their head off to the side and just fill up the ear canal with some hydrogen peroxide. So you're watching for a bubbling. Literally, you'll see the bubbles coming out of the ear. Sometimes it's little, sometimes it's a little bit more, and sometimes it's like a lot coming out. You know that they're dealing with an infection or there's bacteria there, and you need to clean it out. You will also hear a crackling sound. And this confirms an ear infection. So those of us who run to the doctor right away, check my child's ears, give me the antibiotics, this is a good way to check, to see if there's an ear infection. And guess what? You don't need those antibiotics. You just need to repeat this over and over and over. The way I handle it usually is, if you can catch an ear infection in the beginning stages, you can really knock it out really, really fast even with the fever within 3, 4 hours. I've seen it happen, but if you catch it like a day in, 2 days in, it's going to take a little bit to, another day or two to kind of like simmer down. So just keep that in mind. And you always want to do both sides because both ears, it travels back and forth. But basically I do it every single hour, for 3, 4 hours and then taper down. And then I always usually follow it up with like a garlic mullein oil or golden seal echinacea tincture in each ear, just like a drop, just to follow it up with something that's got oil base in there to stay in the ear so that it's helpful. Okay, we did cough, ear infection, flus, sore throat, vitamin A, olive leaf tincture, propolis spray, that honey garlic cayenne mix I told you about. These all are really great for sore throats, from a naturopathic perspective. Okay. Diarrhea, and stomach issues, activated charcoal has to be in small amounts at a time so that the body is able to tolerate it, because if you take like a teaspoon, usually your body will bring it back up. I like the ones that are made from coconut shells. Okay. This homeopathic duo right here, I actually learned from Dr. Imran. So since he's not speaking today, I have 2 remedies from him that I know that he probably would have included to share with you guys. So homeopathy, Ipecac 30C and Arsenicum album 30C. You can give together every 30 minutes until symptoms subside. So child or you are vomiting or diarrhea or stomach upset, something like that, and it's coming with a fever. These two are amazing in stopping that in its tracks. I've actually seen it work really, really nicely multiple times. And another one that he has, and I don't think I don't have it here in my, but I will do a new slide and just write it here so that you see it. So this is for fever in general by Dr. Imran. Okay. He uses belladonna 30C, eupatorium 30C, and baptisia 30C. And you can also I think this one is he takes individually, I'm almost certain. Take individually, like every 10 minutes, you alternate or something like that. And then this is to get the fever to come down. So sometimes, we don't, we're on our trip, we're going to a trip, we can't, or we have a show, or there's like a ballet show or something, and a party, a special family event, and we're just not in the mood to deal with letting the body do its thing, and we need to like cut it out like now. This protocol seems to work really well and really fast, and I'm gonna say like probably 90% plus of the time. So these three are amazing, and I love this tip from Dr. Imran that I learned, and I'm sure that he will be happy to share with all of you this. And okay, I think that is about it for me right now. Does anyone have any questions? Thank you so much, Dr. Imran, for letting me speak today and be a part of this weekly seminar and educating everybody on a variety of topics. Okay. Any questions? I wonder where I probably have to stop share and then check out the chat. Okay. Thank you. Okay, thank you. Okay, so I guess that means that we were detailed enough. I'm just waiting one more second to see if there's anything else. If anybody has any questions in general about, I think B mentioned something about us answering some questions just in general. Anybody have any questions? You can unmute yourself or write it in the chat.
If anyone has any questions that are outside the topic of fevers, we can also try to help you with that.
Okay. I'm the host, so I think I have to stop the recording myself. Let me just double check with Dr. Emlyn here and see if he says anything. Okay.
I have a question.
Sure.
Where would I find information about dental issues? Whether it's receding gums or cavities that are appearing out of nowhere for someone who brushes their teeth multiple times a day and tries to eat reasonably healthy. There has to be something out there that I
There,
could.
so a lot of times if you're taking really good care of oral hygiene, each tooth is connected through nerves to different body parts and organs. So sometimes looking at that can be helpful in figuring out what's going on. And or you've ever been exposed to radiation. Let's see. I think, what's your name? Who's speaking right now? I'm sorry, I'm like not.
Vivian.
Vivian. Do you have me on Facebook? Are you able to look me up? Or if not, you can send me.
I can look you up easily.
If not, you can send me an email. I have a chart and I'll send it to you so that you can see. I'm not sure how to find the chart on my computer to like post it in the chat at the moment. And then that way, you can see which tooth is affected and which organ it's associated with. And it is usually pretty spot on. So that's something that you can think about.
I kind of know that it's the two front teeth and the ones next to them. Their stomach is the two front ones, and on the other side is heart. So
Is that reoccurring for you in general?
I'm sorry, repeat, please.
The digestive system an issue for you or cardiovascular?
Maybe, yeah. I have serious, well, I think they're nuisance allergies, sensitivities to chemicals in foods and stuff like that I'm working on.
Okay. All right. So you want to make sure you heal up the lining of the intestine so that it heals up those leaky junctions and so that you don't get that histamine reaction. I really love slippery elm for that.
Okay.
Vivian,
Yes, ma'am.
Banerjee's, I asked a question one day directly to the Banerjee person on the BP users group regarding and what they said, what they recommended was Merck Viv, VIV, 200C. I assume that would be twice a day. That's for receiving gums. For gingivitis, like sensitive teeth,
Yes.
personally used, I used Hepar Sulf 30C. It took 2 to 3 months, but the teeth that I had that were sensitive towards the bottom near the gum, that sensitivity did disappear. If you want to contact me directly, I have several protocols that I am using for us here. And in particular, I noticed, like us older folks, I think it's going to take a much longer time to try to tackle some of these things. But my daughter, who is the handicapped one, she's 31, and she was getting black spots on her teeth, like black areas.
That's what I've got. Mhm.
And I don't know which one did it because I've got her on like 3 things, but I did start noticing. I was quite amazed. I can't find the black stains anymore. So I'm assuming everything else is also getting fixed. I don't take her to the dentist because she's handicapped, she's uncooperative, I don't want her sedated, and so I have to try myself. But if you contact me, I will send you the protocols that I've been using on all of us and that I have seen great improvement for her. So you mentioned sensitivity, gingivitis in general, I think was also Hepar sulf 30. I want to say there was a pyrogenium in there, but I'm not sure. Again, contact me and I'll look them up for you.
Okay, that would be great. Thank you so much.
Now, we have been on a journey. I have gone carnivore. And from everything that I understand, what is really, so for myself and my daughter, my other daughter, she's 32. My mother had the same issue. We have plaque buildup like massively rapidly. And
Mhm.
if you're familiar with a doctor out there, he's a naturopath called Dr. Tent. Look him up. But I watch many of his videos. He lives close enough to me that I actually went to visit with him, appointments. And he was said, if you have plaque in your teeth, you have plaque in your arteries. So that was kind of alarming.
Oh, that's interesting.
Yeah. Contact me and we can go over the different issues, dental wise, because I know there's a lot of them. But a big thing, and I'm waiting to see what's going to happen with switching to a carnivore diet, which I have been now. I just hit my 4th month. And supposedly, I mean, because it involves basically next to no carbs, next to no sugars. And that's where all of the dental issues come in, if you know, the sugars and the carbs, and much more so for some people. For some of us, I don't know why. So if you want, I can send you a couple of videos on that too.
I would love that.
There is some I mean, I switched over to it because I was watching a lot of videos hosted by medical doctors who had switched over to natural stuff, and they're interviewing people who have been on it 2 years, 4 years, 10 years. There's a woman who's been on it 65 years. And I kid you not, when I saw the video and they show a picture of her, so it's not motion yet. And I made the assumption in my mind that she was about my age, and this woman was 82 and has a cattle ranch and works right alongside her ranch hands every day. And I'm like, that's what I want to feel and look like when I grow up. So, yeah, and she's been on a carnivore diet for decades. And she hasn't dropped dead. So, and she's likely outlived several husbands to be honest with you. So I will send you a couple of those videos as well.
That would be wonderful.
That's
That
amazing.
truly.
I'd also like to add in that mineral, make sure you're having mineral support because our foods are mineral deficient and our, teeth are, need those minerals as well.
Good point. It's hard for me to find one that you test strong for. It seems the kinesiologist has tested me with some of the name brand things that, and they don't test strong for me at all. Just
Try Optimally Organic. I think that's the brand name.
okay.
More expensive, but it's pretty potent stuff. And there's also like fulvic minerals and whatnot. You could also try with that versus like the typical trace mineral ones that you see like on Amazon.
That's a brand. Excuse me. That's a brand. Trace Minerals.
The fulvic minerals.
Fulvic is okay. The older one gets, the more one realizes there's a lot to know, and you realize what you don't know is significant, even though you've been doing things differently from everybody else around you, trying to be mindful of what you're doing with your health. And it's like, it's just, sometimes it's just embarrassing. As much as even though it's minuscule, you'd think you'd be doing better than this. So I really appreciate, Ahava, your comments and you be for, it's very encouraging to hear that there's something that I can do rather than succumb to whatever the dentist would like for me to do, you know? So thank you very, very, very much. I appreciate it.
All the best on your healing. We're
Thank
all
you.
here, like we're living in a very hard times for our health, in general. So we're all here to support each other.
That means a lot. It does. Thank you.
Okay, anybody else have any questions? Okay. All right, thank you everyone for joining us today. We will see you next week again, 1 p.m. Eastern, on Sundays. Share with your friends. It's a great way. It's a free tool for everyone to sort of join in and learn. Even if they can't see it live, there is always a repost and where Dr. Imran loads that up onto his channels. Okay, I appreciate everyone joining us today. Have a beautiful rest of the weekend and great week. Thank you.
Hold on a second. Somebody asked, B, could you please post that in the Facebook group? Linda, post what, the dental stuff?
I think that's what she meant. I saw it coming in when yeah.
Okay. I guess I would feel more comfortable if you just contacted me and I can just email you the whole thing, if that's okay.
Okay.
I'm in the BP users group. Just contact me there. Message me.
I'm under Ahaba McLaughlin on Facebook if anybody needs to also get in contact with me. Okay. All right, amazing. Thank you, everyone. Have a wonderful week.
Thank you, Ahava.